Compliance is one of the messier parts of running a med spa. All the signed agreements, the insurance policies, the staff licenses, the state-required forms, they sit in a stack of PDFs across multiple folders. So we built Dalphene. She's an AI that lives inside the compliance area, and she's already read through the whole library. When I have a question about anything on file, I just ask her, and she gives me back a clean answer in plain language in a few seconds. If this looks like something your practice could use, we'd love to talk. We're building this for med spa owners who want their tools to actually understand how they run their practice. Tell us what's slowing your team down day to day, and we'll keep shaping this around what owners actually need. Details to reach us are in the description. Let me run through a handful of the questions a med spa owner would actually care about. Let me ask this. What insurance policies do I have and when do they expire? She comes back with the 4 active policies right away. The Hartford General and Umbrella both expire January 15th. Beasley Cyber Liability runs through March, and the medical director's professional coverage is tied to Dr. Kim's contract, which ends in December. That's a clean picture in seconds, with renewal months all in one view. Next, which of my staff credentials are expiring in the next 90 days? Nothing critical comes up, but she goes a step further on her own. She flags 3 workforce members who haven't completed their HIPAA refresher and 2 vendor agreements that haven't come back signed. I asked one question, and she connected it to the broader compliance picture without me having to ask twice. Now, something a lot of clinics overlook. What does my collaborative practice agreement let Rachel do, and what is she not authorized for? She returns a clean breakdown. Rachel is cleared for assessments, labs, neuromodulators, fillers, lasers, and certain controlled substances. The patients she has to refer to Dr. Kim before treating are the ones with anaphylaxis history, anyone pregnant or nursing, active autoimmune conditions, or off-label requests. Scope of practice is the thing that gets nurse practitioners pulled in front of state boards, and having that line one question away matters a lot. Now, a real-world hypothetical. If a patient files a HIPAA complaint tomorrow, what coverage do I have? She walks me through the Beasley breakdown in seconds. $1 million for regulatory defense, $3 million for data liability, $2 million for breach response services, and a $15,000 deductible. She also gives me the 24-hour hotline number to call right away. In a moment of crisis, that kind of immediate breakdown is exactly what an owner needs at hand. Now, the question nobody really volunteers to answer themselves. What's missing from my compliance file? What should I have, but don't? She comes back with 9 separate gaps, ranging from staff HIPAA training and unsigned vendor agreements, all the way down to a low battery on the secondary exit door alarm. That's the kind of question that's easy to put off and easy to lose track of, and having something surface those gaps on demand is genuinely useful. And to close, summarize everything I need to renew before March 2027. In a few seconds, she gives me a clean, dated checklist. The June deadline for HIPAA training and vendor agreements, the December medical director renewal, January for the Hartford insurance, February for the California registration, and for Rachel's collaborative practice agreement. That's a 12-month compliance calendar built from the actual file in 20 seconds. So that's Dalphene. She lives next to the library. She's already read it all. And she's there when I want a real answer about my own practice. The owner stays the one running the show. She just makes the file actually useful.